Hello everyone. Good evening. So, I'm really happy to introduce to all of you a very dear student of mine, Dr. Bicky Dutta, whom I've been knowing since his third prof. I still remember the message that he sent me while he was doing his third prof. He had sent me a message after watching one of my quick revision medicine sessions in YouTube, and that is probably the first time I interacted with this dear very student. And ever since then, Vicky has been in touch, and I'm extremely happy that today he has secured All India rank 25 in the INICET May 2024 examination. So, first of all, a hearty congratulations and welcome, Dr. Bicky.
Thank you, sir, so much for the lovely introduction, sir.
Vicky, I think one of my fond memories with you was after your final MBBS exam. I still remember you topped the university exam, and you had sent me a message at that time. And I always felt that you were a deserving topper. And I think post that exam, even after getting the first rank in the university, one message that you had sent me was on further preparation for your PG medical entrance. So you had planned yourself like that, and here you are. The effort, the hard work that you have put in has yielded this massive achievement of rank 25 in your first attempt. And hats off, Vicky, to your determination. And Vicky, I think the viewers would want to know a lot of things about you because yours is definitely an inspirational journey. So, Vicky, first of all, for the viewers, can you just introduce yourself, your college, your state, so that they'll know more about you.
Hello, everyone. This is Dr. Bicky Dutta from Guwahati Medical College, Assam. I was recently doing internship. Just I have completed my internship from Guwahati Medical College, Assam. So, first of all, I would like to thank all the members of this DocTutorials family for giving me a great opportunity to share my views over the preparation of for any entrance examination. So,
Yeah. So, Vicky, I think we'll start with this. So, basically, what I understand is your journey with DocTutorials started in your second prof exam, and you have always liked pathology as one of your favorite subjects. So, you started your journey with pathology. So, just
yes.
tell me, how did you fall in love with pathology? I'm sure you would have loved Vandana ma'am's lecture. So, take us through the pathology lectures of DocTutorials.
So during my second year, there was the first wave of COVID, sir, occurred, sir. That time I
Okay.
was at home, sir. So that time I didn't have any access to any coaching platform, sir.
Okay.
So from that time I started reading Robbins, but I couldn't understand much after reading Robbins. So that
Okay.
time I have opened the Facebook group of Vandana ma'am. Then I knew about her, like the way she taught pathology. The group itself, it's very amazing to see. It's very fascinating. Gradually, I love that subject. So one day I message ma'am if there are any videos available somewhere. So ma'am told that she is currently a educator at DocTutorials. By this way, I have started watching her videos. I got a subscription of DocTutorials complete package at pathology. Then gradually I have started watching her videos and made my own notes. And her notes were my primary source of preparation in pathology. And always I updated my knowledge of pathology along with her group and her revision videos and her discussions, which she conducts regularly on Telegram and Facebook. So she doesn't teach pathology; she makes you love pathology actually.
That's
She is a
great.
great teacher. Always, I would like to thank her. The way she teaches pathology like no one else can teach pathology. Like it's very great. Sir.
As you rightly said, she is a wonderful teacher, and always she correlates pathology with medicine. And I think for a vast subject like pathology, I think it's always a bonus to have a teacher who simplifies concepts. And Vicky, as you said, pathology, primarily you relied upon Vandana ma'am's lecture as well. So did you follow madam's main videos along with the revision videos as well?
Yes, sir. I prepared my notes with the main videos, and during the internship, I have watched the QRP sessions
Okay.
and the revision videos of.
Okay. And I think Vandana ma'am also has a good social media presence, and
Yes,
in the WhatsApp groups also she constantly keeps
yes,
students motivated. She puts a lot of questions, clinical scenario based questions, also linking pathology, medicine, so many image based questions. So I know that you were active in those groups as well. So how active was, or how useful were those sort of discussions in ma'am's groups as well?
the ma'am used to give target to complete this part of pathology by this end of this, and she used to put a quiz on the Telegram or the Facebook group. So I used to follow those schedule, and I completed those portions of pathology during my internship. So it helped me to give a proper guidance how to go about with pathology and complete it within a course of around few 1 or 2 months. So by
Okay.
this way, it really helped me.
Okay, right. And I think pathology for INICT is very important as well. So I
Yes,
hope you could
yes,
do well in the pathology questions as
yes,
well,
sir.
correct?
Yes, sir. Almost all I did correct, sir.
All
Absolutely.
right. All right. And so that's it. I just wanted to ask you about pathology. You have, given your views about it. Now, always Jayprakash sir talks to me about you, and sir has high regards for you as a student as well. So for forensic medicine, was JP sir's videos your primary resource?
Yes, sir. Right from the second year itself, I have prepared the notes of JP sir, and only I relied on his notes. Like, they are the gold standard for forensic. Like,
Okay.
I used to revise them at least 10, 20 times. And also, sir has a beautiful Telegram group also where he discusses the topics and put some MCQs topic wise. So it regularly helped me to stay updated. Also, the important sections, the important laws of forensic, which are very difficult to remember actually just before exam. So by this way, he always motivated also, and also made us stay updated with the subject, because the forensic nobody reads, they always read before exam, like 1 or 2 days before exam, but the forensic subject plays a vital role to decide your rank, because around 10 to 12 questions will definitely come for forensic in any entrance examination. So
Yeah.
JP sir videos and notes were very helpful.
Okay. Yeah, so I think sir has a very unique teaching style, so that you are, sir actually highlights a lot on the most important points, and with that sort of experience that sir has, wherein along with the teaching aspect, he also pinpoints from the topics. Okay, these are the questions that have come from these topics, so that it makes it a lot easier for you when you do the questions. Correct?
Yes, sir.
And also in the Telegram group, I think that also gives you a motivation. You were speaking of Vandana ma'am's Telegram group and WhatsApp groups, and then JP sir's group. I think JP sir also used to put questions according to a schedule, and then that actually motivates the students also to go through it. And see, when your faculty puts a question in WhatsApp groups, I think you get authentic answers as well. So
Yes,
it's
sir.
a good
Yes.
MC practice in such a scenario, right? Now, coming on to other subjects, ENT, which platform was your primary resource?
So ENT, the Rajiv Dhawan sir notes for my primary platform.
Okay. So you had followed ENT entirely from Dhawan sir, correct?
Yes, yes, sir. Completely.
Yeah. So how were ENT lectures in DocTutorials?
So ENT lecture doesn't only teach us the ENT as a subject. Like, it helps to know the how beautiful as a subject ENT is. Like the middle ear anatomy. So is to go inside the middle ear. So is to create some like handicrafts to teach the boundaries of middle ear. Then we can really visualize, because the level of questions they are asking nowadays is pretty clinical. Not, they don't ask theory. They ask the image based question and the application of those topics. So he made us realize that what are the important things we have to learn from this portion of ENT. Then he puts up questions in his Telegram group, By this way,
Okay.
uh, along with the notes and the group discussion, as a subject, the ENT is, uh, I feel it's completed for me.
Yeah. I think Sir has a very innovative method of teaching as well. And Bicky, you might have noticed that recently he has introduced operative videos also in his lectures, so that
Yes,
students, like get an actual feel. Okay, like if you
yes,
want to exactly know what is ongoing in an operative procedure in ENT, you can directly visualize in those videos. So, it's if you get that three-dimensional view of the anatomy, the operative procedure becomes a lot easy. And when you see such a operative procedure, your concepts are rock solid, so you will not have to mug up again. Correct.
yes, yes,
Right. And now, coming to final year subjects, beginning with my subject. So Vicky, like, how did you use my lectures? I know that the first session you attended was that revision session, and after that, how did you utilize the video lectures, and which all topics did you emphasize in the doc tutorials videos? Medicine.
so, so after the QRP session, actually I wanted to watch your videos of medicine. So I got the subscription and I watched your completely neurology, which was my primary source of preparation, and few of CVS I have watched, and GI surgery and some basic sciences also I have watched from your videos, and some along with some practical videos also which you used to conduct during the YouTube session, and the practical case discussion also I have attended. So this for along with this, I have ensured that medicine is complete as a wholesome by watching your videos, sir. And also I followed it up with the QRP session, sir.
Now, since you told about neurology and cardiology, now that you have got such a massive rank, which branch are you going to take?
So it's not decided till now, but I guess among gastro neurology, I will decide anyone.
So you want to take medicine and then you want to super specialize. Okay.
Yes,
So
sir.
neurology, so you're going to give me a competition as well. Right. Okay. So it'll be a pleasure, Vicky, and let's hope that we meet again for the super specialty entrance coaching as well, because I've been mentoring students for the NEET SS as well as the INISS entrance exam. So, I think we might meet again for those
Yes, sir.
classes as well. So, Vicky, I still remember, whenever I conducted a live session, you know, um, as a student, not in your, internship, I saw that interest in you right from the time you were a third year student. Because, Vicky, I'm sure you would remember there was one session where I was discussing some ECG based questions, and
Yes, sir.
you were very enthusiastically answering. Many of them you got right, but a few of them you went wrong, but still you wanted to correct. Okay, sir, why is this? So I think one of your important qualities was that eagerness to learn, or you had that, rather than learning something for your entrance exams alone, you had a special interest in medicine, right?
Yes, sir.
Okay. So why were you fascinated to medicine? Like, when you joined MBBS, did you want to become a neurologist or a gastroenterologist, or did it come somewhere in between?
So initially when I joined MBBS, I had no clue like which branch I have to take. Just I wanted to pass this phase. But towards the end of my first year, I had some, after completing like physiology and biochemistry, I had some inclination towards the subject of medicine, because
Okay.
medicine covers everything. Almost all the 19 subject knowledge you have to know to treat a patient as a wholesome, because
Okay.
everything is integrated with each other. Because if you
Okay.
study medicine, you have to you study all subject. Like it's a gateway to all the subject. So I wanted always to select a subject which allows me to stay in touch with all the other subjects which I studied in MBBS. So
ठीक है, ठीक
medicine
है.
is only the subject where I would have access to all of the subjects. So that's why I had keen interest on medicine.
And when you used to watch my videos as well, like, did you try to link it with the basic subjects? For example, neurology videos, I used to start with some basic neuroanatomy and then
Yes.
go on to the remaining part of stroke. So, was your method also like that, or you straight away went to the clinical features management like that?
No, sir. I initially I have made sure that I have understood the neuroanatomy, the physiology, and the biochemistry behind the disease. After that, I went for the clinical feature, the management, and the prognosis part. Because if
Okay.
the basics are not clear, we can't diagnose the disease. And to
Okay.
approach any question in exam, they will test you the basic concept of every disease. Like this year, INICET, all the basic concepts were tested of the common diseases. Starting,
Okay.
they have integrated with patho, micro, everything. Almost all the subjects they have integrated. So you have to
Okay.
you have to have a wholesome knowledge to solve those questions. So I think the approach should be starting from the basic sciences, then you upgrade your skills and go up to the level of diagnosis and managing the cases.
And I also want to share to the viewers another happy, news that there was a medical quiz that I had conducted, the Medi Olympiad National Quiz, and wherein I was conducting the finals as well. And Bicky was All India first, correct, in that Medi Olympiad quiz.
Yes, sir.
Bicky, you liked quizzing a lot, right? During your,
Yes, sir. Yes, sir.
yeah. So I have seen you very active in quizzing. I think you yourself, used to conduct small quizzes for
Yes,
juniors.
sir.
Am I right?
Yes, sir.
So I think that's good. That's good because to get a national first in a quiz competition, that DocTutorials has conducted, I think is definitely a very big achievement. Now, coming to the other final year subjects, pediatrics. Uh, I hope you listen to Sandeep sir's lectures.
Yes, sir. The Sunday lecture were my primary source. I have prepared the notes after listening to the lectures. Then I followed it up with the QRP session, sir. The PDF was awesome, sir. The PDF was, the notes were very concise scripts and like they will give you answers. Like they will sure the questions will be coming from sir's notes either directly or indirectly. You have to know how to solve those questions. Like this INICT also almost 90 to 95% questions were from his notes only.
So, what did you like about sir's method of teaching, Sandeep sir's method of teaching?
So the approach to the diseases I like the most, sir. He also integrates the diseases with the basic sciences like the metabolic disorders, like the uh, glycogen storage disorders. The way he's to connect correlate with the biochemistry, then he's to integrate it with the basic sciences. Then again he come back to the final year and teaches the treatment of those parts. That the way I have loved very much, sir.
Okay, right. And you used to follow some lectures of Raja Mahendran sir also, right?
Yes, yes, sir. The GI surgery and many parts of basics general surgery I have to follow, sir. The lectures were very good, sir.
So I think sir has a very unique method of teaching, and sir actually explains through some beautiful diagrams as well.
Yes,
Okay, and since he's a very busy practicing surgeon, and many a times he actually brings out examples from his own, day-to-day
yes, yes, sir.
practice. So I think that must have been, I think many students tell me that when they watch Raja Mahendran sir's lectures, sometimes they can visualize, okay, this is how you have got to do, and they have that interest in surgery as well. So I hope that you found those lectures very interesting, right?
Yes, sir. Yes, sir.
Yeah, right. And then I think you had watched some anesthesia videos as well from Doc
Yes, yes, sir.
Ashish. Sir. So which all modules did you
Yes, sir.
watch?
Sir, the intubations and the basics of ventilation and
Okay.
oxygen delivery systems I have watched.
Okay. So I think they were very concise and crisp
Yes,
lectures, I
yes,
suppose.
sir. Yes,
Right. And Vicky, you must have done the Q bank also of these subjects from DocTutorials. And
yes, sir.
how did you find the Q bank?
So the QBank gives us a wholesome approach towards the subject. Like it consists of questions of difficulty ranging from easy to hard. And the explanations were very much curated by the faculties. Like they were almost all the explanations were authentic and from the standard text. So it not
Okay.
only helps to understand the correct option and what are the options we can rule out if any questions come from that topic in future. The explanation made sure that you won't miss out anything of the topics. Wholesome yet knowledge you will get from the QBanks.
And as you rightly said, I think of late we have made so many positive changes in the Q bank. The DocTutorials Q bank has been entirely curated by faculties. So suppose if you're watching lectures of a particular faculty, the entire Q bank is framed, the curated and verified by the corresponding subject faculty, which gives students also a, a sense of relief, because they have authentic questions, authentic answers, and that is definitely going to benefit them. And Vicky, I think even in the DocTutorials app, we have got so many leaderboard quizzes that we used to conduct. So, did you have the habit of solving those leaderboard quizzes?
Yes, sir. I was regular in those quizzes, sir.
Okay. So, I think you always like this quizzing, and you wanted to be there,
Yes, sir.
right, in
Yes,
such
sir.
quizzes. So, I
Yes, sir.
think you were doing very well in the leaderboard quizzes as well, right?
Yes, sir.
Vicky, thanks a lot. I think your suggestions will definitely help the juniors. But before I wind up the interview, if you have to give an advice to your juniors, let's assume that the Bicky who messaged me in third prof. Suppose there is such a student who is currently in third prof and wanting to do well in the entrance exams. What advice will you give to such a young Bicky?
First of all, the importance of uh, having the importance of the building an interest to the subject or towards the any examination is important. If you don't have any interest, you can't succeed in any path you go. That interest is very important, sir. After having the interest, then you have to work hard for it every day. You have to promise yourself, like, I have to dedicate the few hours of even few minutes of my day towards that goal. Then, so the persistency and the discipline is very important in any journey, sir. So for me, I was very persistent in my studies. Like, I never used to miss any day without studying, sir. Either I would solve some q bank also if there were low days, and in the high days I used to go up to around 10 to 12 hours also I have studied, sir. So the persistence is important. Like, even in the internship, which was very hectic in our college, so I made sure that in the hectic posting also I will solve some MCQs or watch some revision lectures or revision notes, or the questions which I got wrong during solving cubing. I made sure I used to do something or the other every day. So I didn't sit any ideally any day. I didn't miss any day, sir. So persistency is very important, sir. For any rank or for any achievement in life, you have to be persistent in your efforts, sir. That's the most important thing which I could advise all my juniors, sir.
All right. All right. So, thanks a lot, Vicky, for joining and sharing your experiences. I look forward to seeing your success in future as well, because definitely, your journey is an inspiration to many young, enthusiastic students, and I'm really proud of you. And I say this wholeheartedly because I've seen you from that enthusiastic kid to a national topper, and extremely proud of you. Congratulations once again, Dr. Bicky.
Thank you, sir.
Thank you so much.